Hi everyone. Welcome to the NIHR Insight Engagement Programme for the West Midlands. The webinar today is presented by Staffordshire University, Birmingham Community Healthcare NHS Foundation Trust and the Staffordshire and Stoke-on-Trent and Shropshire, Telford and Wrekin Health and Care Research Partnership, and that's SHRPA for short. The webinar is to understand what constitutes good practice for community engagement, including reaching out to underserved communities. So I'll now hand over to our presenters to introduce themselves. Thank you very much.
Thanks, Alicia. Good afternoon. My name is Nachi Shokalingam, and the Insight program, I've been involved with the design of the program and aspects of delivery of the program. I used to work for Staffordshire University. I've just left Staffordshire University, but I'm still involved in this program. And as for today, I'm representing Staffordshire University as a visiting professor. But I'll be involved in the program, and I'm happy to mentor people in this region, and I'm involved with all of the higher education institutions within the region in one shape or form. We'll try and keep our presentations short so that we'll have plenty of time to discuss potential topics and try to answer some questions that you might have. Hopefully my computer works. So the webinar topic for today is to understand what constitutes good practice for community engagement, and particularly focusing on underserved communities. And that's what Fatima and Christine would be talking about. But before that, what I want to do is to give you a feel for engagement, and to give you a feel for what is engagement from my own perspective, from my own research projects. Engagement essentially is all sorts of things. If I sit here and then try and define engagement, I'm making a fool of myself and also making a fool of everyone in this room. The engagement can come in various forms, and it really depends on the proposed project, what you're trying to do, and depends on the subject area. It can come out of It can also come in various stages of the projects. There might be one project where the level of engagement might be low at the beginning, but you might need to engage a lot during delivery. Or in others, it might be that you might have to have much higher amount of engagement at the dissemination stages. In others, you might have to engage a lot during the design of the projects if it is policy related stuff. There are also elements of quality and quantity of engagement. That's what we're trying to cover in the next 10 minutes or so during our presentations, so that you have plenty of time to reflect on them and also ask us questions. Now, thinking about engagement itself, I think to start with the question, why should we engage? We should engage with the community. Again, talking about community, the community can be defined in various forms, shapes, sizes, depending on the project. And in majority of the projects and majority of the proposals that we look at, the engagement is important if we need to translate the results of our projects or our research. In many of our cases who are in this call, in this room today, it might be to reduce health disparities. We need to have this community engagement. The community, as I said, it could be public, it could be a research community, it could be policymakers, it doesn't matter. Whichever the case might be, we are engaging with the community so that our project, our results are more relevant, our results are more actionable, and the project itself and what we are trying to deliver is sustainable. If you look at that, here is something that I would say as kind of summarize into 4 bullet points, which will give you a framework which I've used in the past. And I have used this framework within my own projects and when I kind of mentor people whilst preparing your application or during a project delivery or when I am assessing some applications for its scientific content and also for grant applications for awarding grants. So as I said earlier, the engagement can come in various forms, shapes, sizes, and also at various stages of the projects. So these 4 bullet points, as you see on the screen, gives you that framework. The engagement, the community engagement, is essential if you're thinking about co-designing your research. You need to be collaborating with the community to shape the research question itself on those research questions, and you design the methodology to answer those research questions. Automatically, you're engaging with the community in the delivery of the project. And also, it's about participatory decision making. And if you involve the community directly with the decision making process, then the translation of the results becomes easier. The community engagement is also really key in terms of policy influence. If you see, I'm going to talk about a couple of my own projects in a minute. And in the last 5-6 years, from a lab-based researcher myself, and I've translated into delivering projects, looking at research questions which directly influences policy. So you got to think about when you're designing your project, when you're designing a research question, you need to think about the results. Not every project, I'm not sitting here and saying every project should have a policy influence. Majority of the stuff that we tend to do at this level needs to have some kind of policy influence. And some of us in this room, it might not be direct government policy. It might not be something which influences in terms of political policy making, but it could be, say, for example, NIHR guidelines. It could be screening guidelines for a specific disease. It could be a local government social policy. It could be, say, I don't know how many of you are in the room and what your backgrounds are. It could be, say, some of you might be involved in social care in terms of falls or prevention of falls. So even at various levels of policy development, you need to think about community engagement. And that relates then back to the last bullet point in terms of program development. Probably we can expand on some of these during the question and answer sessions or during discussions. This is something for you to reflect on if you're already thinking about a specific project. The core concepts of those 4 bullet points is about, you need to think about community engagement as an ongoing iterative process. There's no specific rules. There is no specific ways of doing it. That's how I always see it. And there might be some books, there might be some papers and saying this is what you should be doing, point 1, 2, 3, 4. For me, it doesn't work that way. It's always an ongoing process. It's always an iterative process. You might do something which might then lead on to something else. You might be engaged with a specific community. Then you might, during interaction with that particular community, you might think, oh, I'm not engaging with another community because it might. So it's essentially an ongoing iterative process. And the second bullet point is very, very important. It's about defining the roles, setting the expectations, and also communicating with the community partners. I've been involved with a couple of projects where we worked with kind of older adults in the community. And it is about setting their expectations. If many of them have comorbidities, many of them have long-term health conditions, we're not going to solve everything. We are looking at a specific project and we want them to engage with us in a very specific way. So it is about defining and communicating the roles is very important at an early stage. And the third thing is also key for an effective engagement: mutual trust and transparency. If you don't have transparency and trust, you're not going to have good engagement. And finally, the outcome measures. And measuring those community outcome measures is key. I don't know, I'm going to touch on something else again. I don't know how many of you are involved at higher education institutions, how many of you are involved in research, and how many of you know about REF. If I put my REF hat on, I was a panel member in the last REF. When we assess impact case studies for REF, Research Excellence Framework, and community engagement and the impact in the community was one of the key factors. So when you're thinking about projects, when you're thinking about writing a project, when you're thinking about delivering a project, it's key that you also think about core research, how that research is translated, and the outcomes, how measurable they are. Measuring the key outcomes is important in terms of REF to a certain extent, but wider community engagement. Now, and here is this is not a comprehensive list. This is something that I have used and I've used effectively within my own projects. So in terms of good practice, always, as I said so far in the last 5-6 minutes, it's not about one particular stage. It's about engaging with the partners, engaging with the community at all stages of the project. And the other thing is, many of us still think that this community engagement is a tick box exercise. It is not. And over the years, over the last 10 years, for my participatory research, for my engagement with the community, actually, it has made a lot of difference in terms of the outcomes and the translation of the work. So use me as an example, and essentially, community engagement is key in terms of translating your work. The other thing is about the breadth and depth of engagement itself. Sometimes there are research projects which kind of involve a lot of community, various types of community engagement, but then you lose the key focus of the project. You don't answer your own research question. It's also about, as I said earlier, it's about setting the expectations. You need to have that focus. I'm not going to read out the rest for want of time. I want to give you a couple of specific examples of how we did it so that we can discuss it later after Christine and Fatima do their presentations in terms of giving you more examples. So I want to pick up two specific examples from my own research portfolio. Over the last 10 years, we've been involved with. So again, for the last 15 years or so, I've been involved with diabetic foot research. It's all about prevention of ulcers and also prevention of amputations. I've done various bits of work. I've engaged with communities around the world. I work with WHO on various aspects. I've contributed to policy developments in that space. It started off with understanding the biomechanics of ulcers, biomechanics of tissues. Then early on, we were the first group to actually look at thermography and understanding thermography and understanding thermal imaging to relate it to the incidence of ulcers. And that's a picture on the left. So how did we engage with the community? So early on, when we looked at it, thermography is nothing new. It's been that's a research project around, and there's been several papers. But it is about translating, taking that concept from one area of work into applying into your own. For that, you need to think about which are the communities that you want to engage with to start with, definitely the patient groups, and also about the clinicians. And when we talk about clinicians, it's not just about the endocrinologists or the diabetologists, it's also about the podiatrists, the vascular nurses, wound care nurses. It's about other professionals within both within primary care and acute care. So the reason why I picked that as an example is it's not about one specific group in terms of defining the community. Over the years, depending on the project, we have engaged with a wider and also different types of communities. Same thing on the right hand side. Again, whilst we're doing some projects on diabetic foot, when we were working with a specialist diabetic hospital in India, we came across this study, which is initially developed for neuropathy, developed specifically for people with leprosy. Then we translated that work into understanding the neuropathic effects in terms of diabetic foot. Over the years, we have validated, we have changed that test, and this is now adopted in various settings. And now we are using that to assess a simple test to assess balance. And this is being applied to understand falls in the community. So you start with one idea. Actually, the wider application of that test is elsewhere. So it is about which communities you work with, how you work with them. And so you need to think about that early on when you're designing your projects. That's the main message that I want to give out of these two examples that I've used. The other thing before I finish and hand over to Christine and Fatima is about translating some of your, I've specifically used translating practice to policy because it's not just about research, it's not just about clinical research. It could be some of you might be involved in other aspects. Say, for example, I do quite a lot of work with sports and physical activity. It's about understanding the current gap, and it is about understanding why you're doing that research and the importance of translation. So that comes in defining the research question, and also about what's early on, think about, reflect, and define the role of community engagement. How is this community engagement going to help you in terms of designing your research question? And then when you think about once you've designed your research question, obviously you have a much wider network and you'd have a proper methodology to answer that question. Once you've done that, once you've got that results, how do you translate that result to advocating for that change? And that's where again your community engagement comes in. Once you have that well-defined community engagement, you could have sustainable impact. I think that's what I've got. I'm going to hand over to Christine and Fatima to do their presentation. Then we'll have plenty of time for you to ask questions and to engage with us. Over to you, Christine.
Thank you very much. I hope you can all hear us. Can everybody hear us? Good.
Yes, we can, yeah.
We're just going to share our screen first. You didn't want to do... Right, so my name's Dr. Christine Burt and I'm the Director for Research and Innovation at BCHC, Birmingham Community Healthcare Trust.
Hi all, my name is Fatima Zakia. I lead on this project called Community Connections from Research and Innovation Division, Birmingham Community Healthcare NHS Foundation Trust.
Right, so I'm going to hand over to Fatima to sort of introduce where we're going to actually make a start. Let's see if we can get our slides up and in presentation mode first so that you can all see them. Right, can you all see those now? Great, thank you.
Okay. So just an introduction about Community Connections. So Community Connections is a collaboration between the NHS, academia, research delivery partners, local service providers, and voluntary community faith sector enterprises. And what we try and do at Community Connections is to tackle health inequalities in the underserved population in Birmingham. Just how and why Community Connections started. So Community Connections started as a pilot from NIHR. And this was funded 3 years ago as a patient and public engagement program that seeks to foreground the lived experiences of the local communities regarding their health and access to healthcare services. This helps to adapt our services to better meet the local needs. And we don't go to the communities with a predetermined idea. We don't design the services that are not fit for the wider community groups in Birmingham. And we try and also inform future health research and develop the understanding for prevailing health inequalities. So most of the things that Nachi said in his presentation, the importance of community engagement, we try and do that and deliver in the communities through Community Connections. How we do it, our vision is to collaboratively work with service providers because we understand there are some gaps in our system where we practice a lot of silo working, and that doesn't help. And that's the reason why there's so much gap in the services, how we provide them to the communities. So we want to work together with all the service providers. We want to work together with the community groups and faith groups in the region. We capture voices in the communities by listening event, community roundtables, focus groups. We try and diversify research recruitment as well and outreach through health literacy and education and training. Sorry, did it change?
I didn't know everything. Sorry, the screen's just frozen on us.
So I'll move on. We do have a Community Connections Steering Committee group where we have a variety of representations from the local authority, West Midlands Police, from some of the other service providers like the academic partners, BVSC, Health Watch, and some of the community trust as well. So our community trust and the mental health trust in Birmingham and Solihull as well. Something wrong with our slides and our network, and it's stuck and not moving ahead. Sorry about that. We work with all these partners and stakeholders to address and to understand what can we do best for our communities. We try and engage with the local population across Birmingham. One of the barriers that we understand exists in the communities is that we parachute in the communities and parachute out and never follow up. And that's the biggest reason why communities lack trust in the NHS and feel that they are not supported very well, their voice is not heard, and they feel that they are neglected by the system. So 3 years of our working with Community Connections, our first year fully was dedicated to build those trusted relationships with these communities, especially the underserved population, because I think trust was the most important element of the work we do. So we tried to build those trusted relationships by going out in the community, working with them, visiting their community centers, trying to talk to people in the community, men and women, and children and young people, and the older adults as well. Birmingham is quite diverse, and we all are aware of it. So it's given the demographic and the make of Birmingham, we had to take this approach. We managed to, oh, the slides are back. Can you see it now? Great.
You tell me when to move, and I'm happy to move. Which is this the right slide, or you want to move forward?
These are yours?
Yeah,
Yes.
you can move now.
Okay.
I'm already blabbering ahead of like 3 slides. So this is the make of the community. Yeah. So these are our stakeholders and partnerships that we have developed in Birmingham. So NIHR, West Midlands Regional Research Delivery Network, Aston University, BBSC, Public Health Team at City Council, West Midlands Police, University of Birmingham. There's an organization called Ladywood and Perrybar Locality Partnership, and they have developed a West Birmingham collaboration called Flourish. So we do work with them, the Birmingham and Solihull Integrated Care Board and Birmingham Voluntary Community Faith Sector Enterprises as well. Next slide, please. Thank you, Nachi. So the work that we do with NIHR is how the thing that Nachi was mentioning earlier is the importance of involving the communities at the design stage of research. And this is what we do at Community Connections. So we try and engage with the communities earlier on. So at the design stage, at the framework stage, we involve the communities, try and set up the design and the framework of research delivery with them. So some of the questions that the communities think, oh, this is not the right question for my community, or this language won't work, or this sentence that you put in your application or in your question is not suitable for my community. That's how we try and work with them and try and change and develop our framework and strategy and some of the delivery elements of the research with the communities, so that we can reach out the communities in a better way. And it's not just one size fits all kind of approach. Next slide, please. Thank you. So the work that we did with Aston University is just an example. We collaborated for a fund from BCHC to Aston University, and there were community organizations who bid for the pot and try and explain to us and demonstrate some of the community-led projects that they would be doing in their specific community groups. So 5 of the community groups got some sort of funding, and the work that they did and they developed with that small amount was amazing. And this gave us a realization that that small amount of money can do wonders in the community rather than spending within the NHS. So this is just an example. There's a link there in the slides. I think the presentation would be shared later, but there's a link there for some of the videos that we captured and the full report of the work that we did. Next slide, please. So BVSC, it's the Birmingham Voluntary Service Council. We try and work with them on certain projects. So one of those projects is called REN, which is the Research Engagement Network Project from the Integrated Care Board. And Chris, would you like to highlight about the REN work?
Yeah, so the across the system, of the healthcare system, the Integrated Care Board is responsible for what happens with healthcare across that system. And so they had some pots of funding that they wanted people to apply for to be able to engage and do something in their regional networks, in their, some engagement in the networks. So people applied for pots of funding and were able to do things within a 6-month window to actually add value to the community engagement. So across the system in the West Midlands, a group of us got together and put in an application and were successful. And so we started and discussed what we thought would be useful and productive to do with this engagement funding. And we firstly thought it was important to decide who was working in this space, so that we actually start creating that network and creating a list. And then we've decided that we need to move forward and actually have a website so that people can tap in one place. So that's one of the things that we're going to do across the system. There's some additional funding for the engagement where we feel that some of the researchers who design research need to understand the communities that they want to do research with. And so some of that funding be about, it's called an immersion program, to take some of those researchers and take them out to meet people and shadow in the communities to understand the groups that they want to work with, so that it will make their research stronger to actually understand the challenges and barriers that people face from day to day. So that's just a summary of the
the other example is the Reach Out project. Would you like to talk
So
about
the research Reach Out project was some funding that we received to try and build some community researchers. So these are people who don't have any formal qualification in research, but were coming together with us and BVSC to do a training program to be able to understand about what research is and how to take research out to communities. And that work was done, and we're now trying to get that program accredited so that there's a training program that can be used in the future. And so far, we have 17 individuals from our local communities that have been trained. And the intention is that we will use these community researchers in future projects and actually pay them a remuneration for their time through the Involve process that is an NIHR program for patient and public involvement.
And I think the idea of developing this project was that we heard from the communities that they also wanted some sort of upskilling that they would like in their specific areas. And we go and engage and talk to people and come back, but there is no any sort of procedure how we can upskill the community so they can work for the community groups that they belong, they want to serve. So that's the idea behind the Reach Out project. Next slide, please. Yeah, so the local authorities, so we have been working with the public health team at City Council and the West Midlands Police. So we have been commissioned by the City Council public health team to explore the NHS Health Checks project, which is a national policy that anyone ranging from the age of 40 to 75 should be receiving an invite from their GPs to attend a free NHS health checks. However, we analyze that there is a gap between what the policy has been set up and what's the real condition on the ground level. So talking to some of the community groups, especially from the underserved wards, we realize that the community groups never heard of NHS health checks, some of them. And in a group of 12, only 2 people had received the invite ever to attend the NHS health checks, and which was a shock, because we managed to talk to the NHS health professionals as well, and they had a proper system where they were inviting people and they had a software installed where they get a notification if people are not attending. So there is some sort of gap, and I think the idea is to explore how services are accessible and available in some of the underserved postcodes as compared to the affluent postcodes in Birmingham. The West Midlands Police, we work with them because there is a violence reduction team and they wanted to organize a community event like a Simmer Down festival. And we from Community Connections managed to deliver a health check at the event, because I think most of our engagement that we have done with the communities is regarding the accessibility and the feasibility of the services. And the communities feel that they can't access the GP. We all know, we are all aware of the problems with the GP access. And I think communities struggle with GP access. So providing health check where communities are was beneficial for majority of the people who hate traveling long distances or can't get access to their GPs, or they're struggling on phone calls and things like that. So it was a public event, Simmer Down Festival. There were communities out there and we just delivered the health checks. It was very well attended and we got great feedback from the event as well. Next slide, please. So University of Birmingham, we work on a lot of projects with University of Birmingham, but I've highlighted 2 here. One is the ELSA study, which is the early surveillance for autoimmune disease. And this study screens children aged 3 to 13 years for diabetes type 1. This was rolled out as a national pilot, and we managed to organize 8 community clinics for ELSA study and recruited over 160 children from the underserved population to the study, which was not something that we normally see, especially in studies like ELSA, because they struggle to reach out to the underserved population. But because we had already built those trusted relationships with the communities, we were happy and we were instrumental in supporting the study as well. We are also currently working on another study, which is developing an equitable public health approach to reducing gambling harms in the communities. And the study has not yet started. We have obviously managed to do some initial engagement for the study, but it will start officially next year. So we are looking forward to work on this project as well, because it's a new territory that we will be exploring. Next slide, please. So Flourish, as I mentioned, is a West Birmingham collaborative. We have delivered some of the projects that they do in schools in the underserved population. So some of the health hacks, as asthma-friendly schools, addressing and creating awareness to children and families with asthmatic child, demonstrating correct use of inhalers and spacers, some of the oral health hacks where children are demonstrated the importance of oral hygiene and the toothbrush techniques as well. Next slide, please. So Birmingham and Solihull Integrated Care Board, we are supporting the BSOL ICB in some of the projects that they are doing. For example, the Work Well project. The Work Well project is, I think it's a project that supports individuals to get employment. So people who are out of employment for more than 6 months or who are currently seeking employment opportunity. This is a project has been targeted to East Birmingham and North Solihull area. And we are supporting for the community outreach and some of the insights that we can get from the community organizations and community groups to support the project. There are some of the links here in this slide as well that people want to tap in and see for more information. Next slide, please. So these are just pictures that these are some of the groups that we work with in Birmingham Solihull. So our work obviously gains traction from the trusted partnerships that we have built from the diverse community groups. We managed to organize 2 community roundtables this year, and there were 3 themes, health priorities that came out of those community roundtables for Birmingham and Solihull. Those were mental health, children and young people, and wider determinants of health. We are currently working with the communities as a co-production mechanism, and we are trying to address those health priorities and other service providers as well. Next slide, please. So I've already talked about this. There's a link that you can watch some of the videos from our roundtable, which was very well attended by over 100 people from the community groups and the service providers. Next slide, please. So these are some pictures from the health checks events that we delivered. We also were featured on ITV News for our work regarding health check. So there's a link there if you would like to watch later on. Next slide, please. We were awarded highly commended at the HSJ Patient Safety Awards in 2023 for the work that we've been doing from Community Connections. Next slide, please. We were also the winner for the Health and Wellbeing Award in 2024 at the Community Inspiration Awards as well. The links in there for more information. We also presented Community Connections at the Research and Development Forum this year in Wales, and we were the community guest speakers from Community Connections for this year. Next slide, please. Next steps.
Next steps. So firstly, I must apologize. You may have seen me moving around. It's because we're in a booth with the plug-in and it looks like the laptop's faded and it may die any second. So I had to make sure that I had something as a backup just in case. So Community Connections has been growing really well so far. And although it started as something for research and innovation so that we could build and get more diversity into our research projects, what we found is that it's grown beyond our wildest dreams. And now the Trust wants to use Community Connections as its engagement arm for the whole organisation. So we will be transitioning from it just being an R&I thing to becoming the engagement approach for the whole organisation moving forward. And so that's, you know, and we want to get that embedded. We're trying to build an approach around Community Connections so that we work to a standard. And that standard is working to what the communities tell us they want and the things that the communities complain about a lot. For example, they want things done with them, not to them or for them. They say that a lot of people swoop in and ask them for opinions and they disappear, and those communities never hear from those individuals again. So one of the things that is going to be one of our standard approaches is that we will always go back to the community to give them updates and be transparent and open with them moving forward. So those are some of the things that we want to do. We want to try and grow and gain that trust with the communities as we develop and move forward, and try and adapt so that we're doing things that we can become advocates for the communities that we serve. And just finally, one of the key things that I think is quite important, one of the key things that I think is quite important is for us to be able to build those relationships and gain that trust, because mistrust is a major barrier to the groups that we work with. And I do think that we need to do as much as we can so that we can gain trust from our community groups. Right, I think we've come to the end of our section. Our laptop may close in a moment, but we're on another system now, so we're okay.
Thank you, everyone.
Thank you, everyone.
Thanks, everyone. Have we any questions for the presenters at all?
People are still thinking about questions. Now, one of the things is the way that we wanted to do it is I wanted to give you some core principles and ideas, and then you got Christine and Fatima giving specific examples of how they've engaged within Birmingham and our region. Again, Alicia, I'm not sure people on the call where they're from. Probably they're from around the patch. I think what I want to say here is please do make use of the resources that you got. When people think about community engagement and particularly health related projects, people think only about PPIA rather than, oh, how do I fit PPIA? Think about how do I engage with the community? And when we talk about community, it can, as I said, it's just not about your own specific patient group. It could be policymakers, it could be clinicians, it could be your own scientific groups. So, and make use of organizations like Community Connections and Christine and Fatima, as they outlined. They have access to these underserved communities, and also they've got a wider network. So it's for you to engage with Christine, Fatima and their group, or someone like me who have got our own networks. I'm a trustee in various local charities and local NGOs. So make use of those contacts and contact us so that we can help you. There is one question for Christine. Yeah, definitely. That'll be we can share the PowerPoint. I'm sure Alicia is going to send you all our presentation.
So I have a question for the group, if that's okay. I'd like to know if anybody here has done any research at all, even without having public involvement in it at all. I'm just trying to understand the audience. Have you been involved in any research at any level? If you have, could you just put your hands up, please? So I can see there's at least two.
Yeah.
2 or 3. Would it be worth just hearing a little bit, even if you just gave us a sentence of what that research was, so that we understand what you've done in the past and what you're looking to do in the future?
Beverly, you have your hand up.
Yeah, hi there. I
Hiya.
work as a specialist midwife at UHL in University Hospitals of Leicester, and I worked in the research midwifery department for about 5 years, which I really loved. It was a really good team. They had a good mix of midwives from the hospital, community, delivery suite, you know, sort of lots of different settings, and everyone usually does 1 day a week. So they get a good all-round feel of, you know, where the skills can sometimes come in handy, where you might need to sort of know the sort of ways to help support a research study because of where you've worked and what your knowledge base is. And yeah, really enjoyed it. So involved in lots of things to do with premature births. We've got a big IGBS, which is Group B strep research at the moment. There's research into this womb study. There's lots and lots of different research. But I've kind of stepped out of that role a little bit now because I'm more in public health. But yeah, really, really interesting. And the points in terms of, you know, like you say, sort of communities don't engage because they feel like, you know, that there's no one going to go back to them after something's happened. So we did do some research or sort of data collection and focus groups on women that had had 3rd and 4th degree tears. And that really helped sort of how we managed sort of the information that we give people and what we include in our antenatal classes and different things like that, because a lot of them said, you know, this was really interesting, and if we'd have known what we know from these discussion groups, it might have changed the way that we might have asked for different things during the birth or what we want for our next birth. So I think it had a good impact in that way. I'll stop talking.
Thank you for sharing that with us. We had others who had their hands up. Do you want to just tell us a little bit about what you've done?
Is there anyone else?
There are a couple of people. Come on, don't be shy.
I saw someone else as well.
I think there was about two or three hands, weren't there?
We're not here to put you on spotlight, so just don't worry. Just a little friendly talk on your experience.
Yeah.
So yeah, there's no wrong and right here.
Okay.
Yeah.
Again, looking at the audience, how many of you are actually, I just put that question up on the chat window, how many of you here are actually going to or considering applying for the Insight program? Definitely Polly is. There is, has this webinar been useful? And again, for Alicia and the wider Insight group to think about, is there something else that you would like to be included in these programs, or a different type of delivery of these webinars? Is there someone wants to say something? Or if you're shy, you could type that up on the chat window.
I have got a Menti that I can share with everyone so that they can put their thoughts down on there, if that's okay. I don't know if there's any more questions. I can share the screen for Menti.
So any more questions?
Okay. I can do the Menti now.
Sure.
So I'd like to thank you all today for giving us such an insightful look at community engagement. So if you could take your time now just to quickly feedback on the webinar, I'll share my screen. I don't know if anyone's used Menti before. It's very easy. So if you could enter Menti into your browser at the top, and at the top of the screen, there should be somewhere to put in the code, which is 5255 2322, or scan the QR code and that will open up Menti, please. And then once you've done that, I'll just share the other screen. So some questions should appear now. So the first question is about agreeing with the 3 statements. So I'll just give you a few minutes just to answer those questions, if that's okay. And there's just one more question on the next page.
Sorry, I missed a link. Can you just go back to the
Yeah,
slide?
sure. I might be, if I can show the joining link, if that's the
Oh, that's
QR
great.
code, if that's any easier.
Yeah, fab, thank you.
Just leave this question on for another couple of seconds. Okay, so if everyone's happy, I can move on to the next question. And this is the final one. So what do you think of today's webinar? So I think you just have to give 3 quick responses on there as well. And these should appear. So we've got some words on the word cloud here, so that's brilliant. So it's engaging, helpful, interesting, mind-opening with some of them. Useful, informative, excellent, nice presenters. Brilliant. I'll leave that open while I just finish off. So this is an ongoing engagement programme for Insights, and there is a timetable of events with another webinar scheduled to take place on the 12th of December. I'll hopefully be advertising the December webinar either today or tomorrow. So if you'd like to register your interest, then please do head over to the Insights website and I can share that website with you if you haven't got it. We'll also be adding the webinar recording to the website too. So if other people who were registered today but were unable to attend can also watch the recording back, and I will also share the presentations with everyone too. So if it's okay with everyone and there are no further questions, I will close the session and thank you so much for your time, and we hope to see you at the next one. So thank you very much. Is there any more questions at all before I close? No.
Thank you, Alicia.
So I'll close the session now. Thank you very much. Bye.
Bye-bye.